Medical imaging, when performed properly, saves lives, saves money, and creates value in the community. It's a really good thing. Where we get into some opportunities for improvement is when we perform exams that don't need to be done, or we perform exams with the wrong radiation dose. And much of medical imaging involves ionizing radiation. The risks of that are very, very small, but if there is no benefit from the exam being done, then the risks are higher than the benefit. For every patient that has an exam done at Mayo Clinic, we use the lowest possible radiation dose, and we're very careful to make sure that exam needs to be done. And if it needs to be done, that it doesn't need to be done with an exam with radiation, or could be done with ultrasound or MRI. So the work on this is decades old. And what we see now is this real exciting opportunity to save lives in this country while saving money. We're starting very simply with the opportunity to improve the care of children by making sure that they have the right exam, performed the right way with the right radiation dose. Mayo Clinic is in a wonderful position to have pediatric radiologists and radiation physicists that have been attuned to the right radiation dose and the right exam for patients forever. And so our medical physicists have worked with our pediatric radiologists to make sure that we have the lowest possible radiation dose for any exam that we do with CT or fluoroscopy or whatever. And it takes a lot of work, but it is absolutely the right thing to do. In fact, we do this for every patient. So the amount of radiation we use for exams should be based on the size of the patient. So a 90-year-old woman who weighs 90 pounds should have substantially less radiation for her CT scan than a man who's 72 that weighs 217 pounds. And so we should only use as much as we need to make the right diagnosis for patients.